Okay, good afternoon, everyone. My name is Paul Robinson. I'm the Executive Director of RISE. This is, I believe, our second webinar for the Community $1 Million Community Resilience Innovation Challenge. Today we have as a guest on our webinar, Sherry Norquist, the Executive Director of Community Engagement and Impact at Sentara. We also have Jay Grant on here, and I'm going to talk for a couple of minutes with some housekeeping details, and then Jay will be introducing Sherry formally, and then entering into discussion. And everyone is encouraged to put their questions into Q&A or into the chat as we go along there. But first of all, I want to talk recap on a number of important details around our challenge for those who are interested this afternoon. The goal of what we're trying to do in this challenge is to enhance the resilience of underserved coastal communities by addressing the core vulnerabilities. And we've been given so much detail by folks in the community working in these areas. We built a very exciting challenge around this. I just want to touch on, first of all, our website. I've got the link in a couple of slides, but if you go to riseresilience.org, that will take you to the landing page for this challenge. We also have a landing page, LISC Resilience, LISC Rise Challenge, which will be at the end here. But there's more information there. There's a recorded webinar with all the details of how to apply and all the details of the challenge. There's applicant guidelines, which is your go-to book for details. Plus there's details about the different topic areas and how it's going to be judged. And I'll come back to that in a couple of minutes here. I want to just run through a couple of important topic areas. There's much more detail in the document here, but obviously affordable housing, since this is a LISC project, LISC associated project, the affordable housing is a very important area to help communities increase their resilience. Economic and job security is another important one, and we have skill development, employment support, innovative work models, and a couple of other areas where LISC actually has some programs already in place. And one of the things that we are offering in this challenge is the opportunity for companies with the capacity to work with LISC to enhance their programs across the area, greater implementation, or even to expand on them in ways that align with the companies and LISC's goals. That's a very exciting opportunity, I believe. Next is health, wellness, and safety. And that is also, this is also an area that is of great interest to Sentara. And one of the reasons why we all team together in this challenge. And Sentara has a number of very interesting programs underway that companies with capacity and the right capabilities have the opportunity of building on and expanding, and Sherry will talk about that in a little bit. In the applicant guidelines, there's a link to the Sentara website that describes these focus areas. So there's more detail to get as you work on your solutions. And also, obviously, environmental resilience is a key part of this, preparing for disasters, especially coastal communities, as well as green job creation and resilience-based economic development, something that the RISE organization has been working closely in for the past 5 or 6 years. One thing that's very important also, and is so important that we've devoted a separate webinar to it, is one of the evaluation tools that we'll be bringing to all the submissions is assessing the strength of the solution in reducing the social vulnerability index or the climate and economic justice screening tool index. It gets a little bit complicated, but basically what we're asking companies who are submitting to do is identify the different areas of vulnerability that are described in these tools, and addressing how they will be mitigated by the solution, by the implementation of the solution. That's a very important process, but we've broken it down to some fairly simple steps, and there is a webinar on our website that you can watch, about 15-20 minutes, and that describes how to do that. We also want your business plan and your project work plan as part of your submission to be considered as a winner. The timeline is pretty straightforward. We started this in April 30th with the first informational webinar. No, that's today. This is Sherry's. We've already done one. Excuse me. May 14th and 28th are other informational webinars, and if you are on our list, which I'm assuming you are, you'll get information about that. June 6th at 2 p.m. is the application submission deadline. Do not go past that deadline. That is a hard line in the sand. July 5th is when we will be announcing finalists. July 19th is when we'll be asking the deadline to submit additional information for companies to pitch to the selection committee. We will be shortlisting finalists on August 2nd, and by September 1st, we will be announcing our winners. So that's the schedule over the next couple of months around this. Obviously, more details on the website, and please feel free to contact either LISC or RISE with any questions you may have in the program. There's the website, the landing page, liscrisechallenge.com, and there's much more information on that. And with that, I've tried to cram as much as I can into 3 minutes. I'm going to turn it over to Jay Grant, Executive Director of LISC, for the rest of the webinar. Thanks. Thank you all. Thanks, Jay.
Paul, thank you so much. Thank you all for attending this afternoon. And again, Jay Grant here with LISC, Hampton Roads, Local Initiative Support Corporation. And it brings me great pleasure to introduce Sherry Norquist here. Sherry is Executive Director of Community Engagement and Impact at Sentara Health. And I've had just the great pleasure also of working closely with Sherry and with her colleagues at Sentara to continually address social determinants of health. And Sherry, actually, if, before I get into the questions, could you give us like a really just quick nutshell on what are social determinants of health?
So good afternoon, and thank you for allowing me to be here with you today. I'm going to get into that in a little more detail in some of our discussion today, but social drivers of health are those things that could negatively impact people that are outside of what we consider traditional healthcare. So it could be, for example, transportation. It could be health literacy. And so as we go through today's discussion, I'm going to embed some of those social drivers into our discussion, and also help you find some places that we have published where you can look into more detail around the clients and or people that you're working with.
Wonderful. So jumping right into it, Sherry, why is Sentara interested in this Community Resilience Innovation Challenge, and how do you see it contributing to your organization's mission as you're continually looking to improve upon these social determinants of health?
So for more than 135 years, Sentara has been giving back to the community, largely through our health services, physician practices. We have home care, and obviously we have hospital divisions that have been giving back to the community. But what we know, we are deeply committed to the community, our employees, and the environment. So as a company, when we start talking about the social drivers, we knew that we had to be intentional about our strategy, because those social drivers impact about 80% of the factors that impact a person's health. And those actually occur outside of our hospital walls. So the expansion of our work started at the end of 2019, and it's centered around researching and adopting best practices. So There is an article that was published by the National Institute of Health, March 2020, entitled How to Anchor Institutions. What are those best practices to address social needs and social determinants? So that really stimulated our further exploration and encouraged our role, the role that we would play in addressing these social drivers by co-creating partnerships and really focusing on population health. So just a little bit about those national best practices that guide our work. These are typically mission aligned. They're systemically focused. They are influenced by our partners and our teams. We like to be open and informative and transparent, and then data driven. So since the inception of this program, we have been looking at these national best practices and dispersing really millions of dollars in funds, but also fostering catalytic partnerships and raising awareness around these vital issues that are impacting our communities.
Thank you, Sherry. What would Sentara, from your perspective, like to see to come out of this challenge? What would it like to see in terms of any kinds of impacts on the health spectrum, on addressing some of those drivers where you talk about impacting 80% of one's overall health? What are some of those outcomes Sentara would like to see?
So, you know, when I think about the statistics and the things that we've been facing for so long, I think it's time for a true change, a collective impact, improved statistics. Because if you have a chance to review that NIH article, you'll probably recognize through the citations in there that a lot of money has been invested, but there hasn't been a true improvement, if you will, in the statistics. So the improvement and the sustainability through the following things is what I am looking and what we are hoping to see, which is resource accessibility, meaning sustainable resources and services for the community. These might include, as you know, as you mentioned, educational opportunities, healthcare, cultural enrichment, and then as Paul mentioned, you know, what is housing and job security look like in this space? And that will eventually improve the health and wellness. Another topic would be leadership and advocacy. You know, taking on leadership roles and encouraging people to have civic engagement within the community, being part of the decisions that are made that impact their communities, and advocating for local interests and engaging in policy discussions that truly shape the region's future. And that really leads me to think about that health and safety piece of things, right? So many people understand the issues that our local communities have around violence, and that's, you know, that's a politically charged issue. So we want to encourage people on the civic engagement aspect, and then working from the bottom up by listening first, making sure that we're partnering with the people that we are helping, engaging with community through various activities. So I appreciate you inviting me really to this platform so that people can be involved before they make these applications, because we're looking for true partnerships, long partnerships, not just one and done types of partnerships. And then these programs that we're looking at are going to be designed to improve the quality of life and the economic prospects for local residents. Another thing I'd like to see is inspiration, and how does that relate to our economic engines by stimulating local economy. This could be through direct and indirect, right? There's ways that you can purchase local small business capital projects, looking at how do we attract more workforce, where we offer stability, and where these investments are really place-based, and they're investing in the neighbors and the family members that we have in our local environments, in our communities. And then long-term investment, this commitment to the long-term well-being. You know, I always like to say, Jay, that we look at least for me, I'm a nurse case manager by training, and I always have to think about the here and now, what's happening in my emergency room. What are these emergent social issues such as food insecurity, But I also like to think that these types of challenges, these bigger investments are looking at true generational change, which leads me to my next topic around stability and resilience, providing stability and resilience to local economies, to families, and helping them really be sustainable through downturns, whether they're economic or, as we all witnessed, through the pandemic.
Sherry, I'd like to go back to something you first mentioned a moment ago about creating some kind of transformational change. I'm kind of changing your words a little bit. So we've had a lot of investment looking for transformational change. So have you seen small businesses and or nonprofits successfully create that type of change? And if so, do you have any examples? Of course, if there's anything proprietary, we understand that. But just trying to think concretely if there have been, or maybe if there's been an entity that has somewhat moved the needle, and then and this is kind of an either or. Do you see opportunities, or based on the changes that Sentara and other healthcare institutions are looking for, have you what do you see on the horizon as, hey, we really need to address, like you mentioned, food insecurity? And I can repeat anything because I kind of put it into a paragraph form. Sorry, Sherry.
Hey, I think what you're asking is, what are those real tangible examples of where we have seen some early wins? Immediately one thing comes to my mind is, what I've learned across multiple of our markets is businesses and small nonprofits. I know more in the small nonprofit space, faith-based institutions who tap into volunteer networks and partnerships with universities. It's kind of a twofold thing, meaning if you're working with a university, you're not only providing a training ground for a local inclusive hire, but you are also potentially looking at data that's going to be utilized to your best interest when your project or when your particular intervention is over. So I think about in the Norfolk area, 4Kids. So this is a nonprofit that's extremely stable and resilient. They take upwards of 70,000 calls a year. They've expanded. They do have a tremendous volunteer workforce. They started off as a faith-based institution. So I know that they work with the universities, and I know that they're looking at ways to, not just reduce poverty and homelessness, but really to eliminate it. So again, thinking about other partners such as you all and us coming to the table and looking at ways to educate not just the 4Kids patients and population or neighbors, but opening that up to the larger community that they're serving. So that's one example I can think of, Jay, off the top of my head. I think that's really innovative. Not just, hey, here's my issue today, here's what I'm going to solve today, but how do I look at this a little more at the neighborhood level, and how do I think about it from a generational perspective? And so when I think about a nonprofit's fundraising strategy, a lot of times it's very transactional, and we need to move, as you said, into transformation. So this is about what are the other things that we can do as a health system. And I don't mean do it, because I don't intend to do, housing, but who do I work with to make sure the referrals are coming through, to make sure that we have assets there, such as community health workers or access to the health plans that might also be serving the same clients that may be visiting these shelters. So, I'll go a little bit deeper into the small business aspect, at least around, utilizing local supply chains. This will help us really, truly, again, generationally. That will impact upstream economic conditions that'll build wealth within that community. And so we know a thriving local economy is the basis of a healthy community, supplier diversity, One of the things we did as an organization is hire a director of sustainability. That's pretty innovative, I think, for healthcare. And it's not just a program. We're really looking to embed that into our overarching business strategy. So those are a couple of examples, one internal and one external that I could think of, Jay, to answer that question.
Great. And for any of our attendees, feel free at any point to put questions in the Q&A and chat. Sherry, from a Sentara perspective, and even from an overall healthcare perspective, what statistic or statistics in Hampton Roads stand out to you as being most in need of reversing?
Well, I like to talk about things that I can change, and but it would be remiss if I didn't mention the housing crisis, whether it's emergency or transitional or downstream affordable housing. But if you ask me from a healthcare perspective, Jay, mental health is becoming an increased health concern for both adolescents and adults. We saw between 2018 and 2020, the rate of adults with a behavioral health diagnosis per 10,000 was highest in Portsmouth and Franklin, followed by Suffolk, Norfolk, and Chesapeake. And all that information is available in our community health needs assessments. We publish those every 3 years. We also know that Black women in Virginia are more than twice as likely as white women to die from pregnancy-related causes. I mean, that's a staggering statistic and one that we cannot ignore. Prostate cancer, hypertension, breast cancer, all are adversely impacting minorities. So we are laser focused on, as a healthcare institution, preventions and screening. We are doing a lot of this work by working with the neighborhoods, the churches, trusted nonprofits, the Virginia Department of Health, and anybody who has high touch FaceTime to meet people where they are. So we understand, again, the social drivers of transportation and location. Not everyone has the ability to get to these services. So our goal, and I think Paul mentioned this earlier, was to innovatively create clinics and food pantries, healthy food pantries in the neighborhoods where we know that these health statistics are staggering.
Yeah, those statistics are really, really staggering. Thank you for sharing, Sherry. If applicants for this challenge, Sherry, would like to learn more about Sentara's specific efforts and needs to help refine their submission, to whom should they contact?
So we have a website, sentaracares.com, and there are several places where you can go and see the things that I call them strategic pillars that we're focused on. And also there is a link there to the community health needs assessments, which are located and available in one of our hospital market areas.
Wonderful. Sherry, this has been great. This is always a learning experience when I get to glean information and perspectives from you. So I hope this has been helpful to our audience, in particular, those who are applying for this challenge. So at this time, if there are any questions, feel free to raise your hand, put them in the Q&A or chat.
It looks like we have a couple of questions already in the chat. The first one, I think, Sherry, would be for you from Brittany Boyd. How will Sentara incorporate environmental justice into their new sustainability efforts?
So, and I'm learning at the same time. I like to call this teaching and learning. So thank you, Brittany, for the question. Environmental justice is almost like we're working backwards from the goal. We know, again, that poverty negatively impacts, I'll just say this, young children with asthma. Well, why do they have asthma? Well, they probably have mold in their homes. Well, okay, we have to work backwards from that goal, and having an expert come on board and help us learn and collaborate with those agencies that are focused on this, I believe will be the first step in not only our commitment to the environment, if you will, but also the commitment to improving health as a whole.
Thank you for that. And Paul, I think this one would be directed to you as a RISE question. If a pilot construction project is being proposed Would the applicant need to provide the pilot site in the proposal, or would this come from the RISE challenge program members?
So what I would say to that is, I think it's helpful if a pilot site is identified, but it's also possible for a submission to be considered without one having been identified, as long as there's a process to go through to identify what the pilot site might be. We've done it both ways. It's preferential if a pilot site is already identified.
It looks like those are all the questions for now, but if anybody has any more, please throw them in that Q&A section.
And then of course, feel free to reach out directly either to RISE, LISC, Sentara, if any of our answers need to be expanded upon. We're more than happy to help out there.
And I think the just to clarify, the amounts being awarded are in the $200,000 range. That's another question in Q&A. Well, I'd just like to thank you, Sherry, for your time and for sharing the information. Greatly appreciated, and thank you for helping to pull this challenge together, pull all the participants together. It's really been a good experience so far.
Great, it's my pleasure. We know that the more people we can get working together, the more successful we'll be. So I hope you all have a great afternoon.
Likewise. Thank you, Sherry.